Hello, and welcome to the Nashville Chapter of the National Association of Black Journalists, Crucial Conversations. Our conversation today will be with Elizabeth Hart, who is the Associate Director of the Office of Communications and Media Relations for the Tennessee Department of Health. She has been quite busy during the last few months, and she's been in Nashville for 3 years now, but she's also spent the last 154 days working consecutively, giving out information about the pandemic, where we are with COVID-19. And my name is Sandra Long-Weaver. I am a founder of the National Association of Black Journalists, and I'm active in the Nashville Chapter. So welcome. And Elizabeth, welcome to you today. Thank you for taking time to talk with us.
Well, thank you so much, Sandra, and to the Nashville chapter of the NABJ for having me. It's been a busy couple of months for us here at the Department of Health and really across the country as we all work to fight this COVID-19 pandemic.
Yes, it sounds like it. And working, you have a very different role. We think of essential workers as the healthcare providers on the front line, the doctors, the nurses, people who are right there dealing with the patients who have contracted the virus or those who are testing. But your job, still essential when you have to work 154 days consecutively. I cannot imagine. And I spent more than 40 years in the news business. So I've worked a lot of hours and long days, but not quite like that. So let's start a little bit with talking about when this first started, March 1st. And March, Nashville, those first few days, Nashville was ravaged by a tornado. So you started then, and then right after that, the pandemic hit and everything changed. So let's talk a little bit about where you were.
Yeah, so let's go back to the end of February, really. You and I spoke a minute ago. My birthday was at the end of February, and I actually spent my 40th birthday in the Emergency Operations Center for the state as we began to prepare for what we knew was likely to come. Other states in the country had already started seeing a couple of cases, and so we knew it was only a matter of time before Tennessee was impacted. And then March 1st really is kind of when we really started gathering even closer in our teams here internally. And then I believe it was March 4th is when we announced our very first case. And we started with one case, and it seems like so long ago.
Wow. Wow.
That we had the one case, because now we have well over several thousand. Every day I'm the one that puts out the 2 o'clock report on the numbers, the cases, and that has grown significantly since March 1st. So,
Right.
The graphic, we had just one particular case. We would, in our graphic, we do mention the county of residence. And so that is something that's different in Tennessee than other states. And that's something that's very important that people understand, that every state reports it a little bit differently. In Tennessee, the cases are counted by their county of residence. And so early on, we had a graphic and we had a couple of cases, and it was easy to put their county of residence. But when it became 3, that became 7, that became 10, that became 1,000, it made my job a little bit harder.
Right.
So the graphic grew and grew, and so we had to figure out ways to communicate the most important messages to the community, and that's partly what I do. So I am really responsible for all of our social media platforms. We have both Facebook and Twitter, and we have started an Instagram. Haven't really promoted it a lot, just kind of trying to feel it out and see whether or not there's really a need for us. Had a low Instagram profile right now. It's on there, but we've really been listening to the community, and that's what drives the graphics and the information that we put out. So every single day, we put out information about the case count from the state,
Right.
breakdown of each county and how many cases are in each county. So here in Davidson County, of course, and then we also break down the ethnicity, the race, the age, and the sex of those cases. Now, one of the things that's really important that I think that everyone, if they're not already aware, there is the Metro Health Department here in Nashville, right? And then there's the Tennessee Department of Health, that's the state office.
Right.
is what we considered a metro area, right? So they have their own organization. And so they put out their reports, and then we put out the statewide report. We get a lot of questions every day on Facebook about why is the number different from theirs. And again, it goes back to the timing of which the case comes into our office and gets reported. And that's all the things that go on behind the scenes before we actually put that information out on social media.
So what time of day then? Your report is put out at 2 o'clock every day, but the numbers that you're looking at are as of noon?
No, so those are as of the previous day. Okay. Sometimes there are trickled in the morning time as well. So keep in mind, we are putting out reports for all 95 counties in the state of Tennessee.
Right.
So we are dependent upon the hospital systems, the labs that are actually submitting those reports. And so early on, we would get test results almost every 3 to 4 hours because we only had, 10, 15, 20. When you're talking about, 25,000 tests being processed in a day, we do ask, although we don't get a lot of grace on social media, but we ask for patience because this is unheard of. I know the word that we all in the media have heard 1,000 times is unprecedented, and it truly is. The last time this country experienced a pandemic was in the early 1900s, and
before most of us were born.
We're not even born. So we're not familiar with this. And so I don't want to say we're learning on the fly, but we really are. We are taking all of our expertise. Mm-hmm. I have been in this business for 15 years, not here in Tennessee, but I've been working in public health and medicine and communications for 15 years. And I think that's really vital because you take all of my experience. I've worked in hurricanes, I've worked in other disasters, and this is a crisis, right? And so you take a little bit from each little thing and figure out, okay, what might work best? What do the people want? And so that's part of my role is both graphic design. I had to learn on the fly about 2 years ago how to do.
Paid off, okay. Yeah.
Right. that other duties as assigned, and then you learn how to do it. And so I look at what the community needs are. I look at the questions that are asked, making sure that we have the right frequently asked questions on our website based on the community feedback. The graphics that we produce every day at 2 o'clock have the ethnicity and race dashboard because that is important. People want to know and understand, especially for the Black community, what is the breakdown? We have a lot of questions about, well, there are higher numbers for the white race. And what people need to think about is in context, we are the Black community is a smaller percentage of the entire population.
Exactly.
We are 25, 30, I think it's last 32% of the cases. So when you put that in context, that's when you realize that we are really seriously being impacted. The other thing,
also, you look at the ethnicity, but also the age categories.
Yes.
Breakdown there. And so are you seeing across the ages? Are you also seeing where people of color are impacted disproportionately?
So we have some epidemiologists here that are doing some of that, again, behind the scenes work, really breaking down that data. And I think that's also what's important about how, we get a lot of questions about why are there so many in the pending category. So when you are to go get tested, I'm not sure how many times you've been tested. I've been tested quite a few times, obviously, because I'm out in the public and we do some testing events. When you get tested, you give them some demographic information. And sometimes you don't, because sometimes they just ask you for your ID or they ask you for your name and an email, and then you get tested. If you test positive, then the contact tracers get in touch with you, and that's when they ask more questions, and that's where the real vital information is. But you're not going to have that immediately. The immediate questions or really the things that we need to address are that you're positive. So it's important for you to stay home.
Self-isolation and making sure you have food to eat but still able to stay in touch with people.
Right.
So
and that's another part of my job, at least during the pandemic, is again, really trying to take a pulse of the questions that people have. And so early on, very early on in the 1st of March, up until maybe April, we were receiving a lot of questions about WIC. So WIC, of course, is through our office. We work.
And WIC is Women, Infant,
Infant and Children program. Yes, ma'am. So it's the nutrition program. And so a lot of new moms, I believe it's up to the age of 6, don't quote me on that, who participate in WIC. And so because our government offices were essentially shut down and we were all working remotely, there were a lot of questions about whether or not individuals could still get their WIC vouchers. And of course they could. Mm-hmm. And we took that as a need and created some graphic designs in both English and Spanish and Arabic and French. And I believe we also had one in Swahili, where we make sure we push that information out to the public, because our Facebook is truly our pulse on the Tennessee community. Mm-hmm. Prior to March 1, we had a roughly 19,000 likes on Facebook. As of this morning, we're getting right across 120,000 likes. And so our audience has grown exponentially. Right. I think we have about 43, 44 million impressions since March 1, which is incredible. The amount of eyes that are on our social media pages, which then kind of goes back to your point. It makes my job that much more important, right?
Oh, definitely.
So we are getting the right information to the community.
Yeah, and so now one thing that's different also about this era that we're in is the phases, as people, the economy basically shut down, restaurants closed, businesses shut down for months. Right. And then as the numbers were getting better, we started phasing in so people could go back to work, businesses could reopen. So how did you decide to put out the information about the different phases that we're, and I believe now we're in phase 3. We went back to phase 2 for a minute.
So since this is here in Nashville, so actually that's Metro. And so that kind of goes back to their different organizations. So that is actually left to the local jurisdiction. And that's actually what has happened in Nashville. So they've had the phase 1, phase 2, phase 3. I think it goes up to phase 4. And that's based on their Mayor Cooper, as well as all those that are on his own COVID-19 task force.
Okay.
The state level, that's not what we are in. We're not in the business of the phases, right? So we of course take our direction from Dr. Lisa Piercy, who is my boss, the state health commissioner, and of course Governor Bill Lee. And so the two of them, as well as all of our teams, look at the data, right? And so if you remember early on, there was a decision to make the stay-at-home orders, and that was based on the number of individuals, positive cases, and how it was being spread in the community. And then as cases, you heard about flattening the curve, right? We watch the curve every day. So we base that on data, and that's what our folks here do. And again, what my role is in communications is trying to ease some of the concern and the fears. Right. So
giving out enough information by being transparent about what's going on.
Exactly, and making sure that we are addressing all communities. One of the beautiful things about Tennessee Department of Health that we're really striving to do even better every day. Nothing is perfect. So we're going to keep trying more and more. Is being diverse and inclusive. I talk a lot prior to COVID, I did some presentations around the country about the importance of diversity and inclusion in your messaging, especially on social media. I always tell organizations at the beginning of a presentation to pull out their phones and to look at their organization's Facebook page, to click on the photos. Don't read the captions don't matter. I mean, they do, but not in this particular exercise. And I want people to actually flip through and scroll through just the photos.
Mm-hmm. So it's a visual exercise.
It's a visual exercise to make sure that you are being diverse and inclusive. And a lot of times we think of race, right? But we also need to be diverse not only in race and all the different melanated individuals. So, right, we have our fair skinned, we have our darker skinned, we have our brown skinned girls and brown skinned men. So looking also at the sex, how many pictures do you have of men and women? How many do you have of young people and old people? We work very, very closely with DIDD, which is the Department of Intellectual and developmental disabilities. I had to get their acronym correctly, with DIDD, to also make sure that we have imagery of individuals who have some kind of physical ability, right? Or we don't say disability, right? So we make sure that we have representation from everyone. I know early on in the COVID pandemic, we were receiving feedback from individuals of Asian descent who actually reached out to us and said, we don't see enough of us. So I have now made sure to be much more inclusive of Asian representation on our page. During a pandemic, especially when we are, ground central station for all of the data, it's important that every Tennessean comes to our page and sees themselves. And so people all the time, just do an audit of your own Facebook page and look to see what kind of images that you have. Now, obviously, if you are a Black organization, you're going to have a lot of Black imagery. But if you're an organization such as us, that we are responsible for 7 million people in the state of Tennessee,
throughout the state, right?
Make sure that all 7 million people come to our page and feel like we're talking to them. And so we, with that comes, some commentary, I will say, from some individuals, but we certainly push forward because it is important that representation does matter.
Right. And if someone wants to take a look at the graphics on a daily basis, what is the website or the Facebook address that they should go to?
So the Facebook is facebook.com/TN Depth of Health. So TN Department of Health, we abbreviate department. That is actually our username for both Facebook, Twitter, and for Instagram. So it's TNDEPTOF Health. So you can find us on Facebook, Twitter, and again, we're low key on Instagram.
Yeah,
it is just me, and so my bandwidth is only so large. But we have an amazing team here at the communications office. So before COVID happened, I was one of the main individuals who handled media inquiries from reporters, right? And once COVID happened, we had to divide up. And so since I have the social media expertise background, I was already doing Facebook and our social media. And so that is primarily my responsibilities during this pandemic, as well as graphics. But I also have a background in marketing. And so I am the one that has been behind the scenes working with our departments on specific PSAs, so public service announcements.
Right.
I've remembered back in May, we had a minority health campaign, which featured a Nashville poet, Rashad the poet.
Yes, I remember.
We actually worked with him. He and I went to undergrad together. And so we were thinking about doing this particular PSA. Someone had brought up his name in one of our mini task force meetings. And I said, hey, I know that guy. And so I reached out to him. And so we believe in keeping it local. And so two of the spots that we ran during that campaign were to recognize all of the first responders during COVID-19 who are African-American. And it's interesting that you brought up the first responders, that I don't consider myself a first responder. I'm part of public health, which, I'm not on the front lines.
Right.
And so
but you're on the front line of disseminating information.
This is true.
And with the pandemic, that's what people want. They want to know. They want to know the numbers. They want to know where they can get help. What should I do? Who can I call on?
Right. And so we wanted to recognize all those first responders, teachers, and bus drivers. You don't think of it as a first responder. And so we actually received images from folks all over the state who are African-American, and we featured them in a commercial. And so that's actually, I work with the videographer, and so we were able to produce that spot. Have also been producing spots about immunizations. You and I had a small chat prior to this about the importance of the COVID-19 vaccine. And so not just COVID-19, all vaccines as children.
Which the flu vaccine now is one of them.
Well, and as some students have gone back to the classroom and there is a schedule that you need to stay with. And so we produced a full campaign about immunizations. And so I also do that. So I handle all those contracts and the videographers and setting up the script and all of that. And so I have a really good pulse on the community from all aspects. Prior to COVID-19, which, jokingly here in the office, we call it BC, so before COVID, we, I did a wonderful project that I'm super, super proud of, called the Tennessee Faces of Opioids campaign.
Oh.
I'm one of the few people in this building who have actually traveled to all 95 counties in the state of Tennessee,
Wow.
talking to individuals whose lives were impacted by the opioid crisis. So that's one whom either it was a law enforcement officer, a judge, an ER physician, individuals who are former felons who were actually once, we say once addicts, but they believe they're currently still an addict because they at one point had that addiction, and people who are parents and family members of individuals who passed on. So we told the stories. That to me is how we change a lot of our behaviors, is by learning from other people. And so I traveled and actually listened to these stories and captured their stories on our website, which is tnfacesofopioids.com. And we have videos and we have testimonials from individuals, really to show that it can impact anyone, Black or white, young or old, and it does not matter how much money is in your bank account. So I stay very busy.
You have been busy, and if you've been to all 95 counties within the 3 years that you've been here,
yes, ma'am.
You've been doing quite a bit.
Yes, ma'am.
Well, listen, we want to thank you for being with us today. Our guest has been Elizabeth Hart, who is the Associate Director of the Office of Communications and Media Relations for the Tennessee Department of Health. Thank you. And
thank you so much, Sandra. I do want to say to everyone, you know, the importance of washing your hands and staying at home if you are ill, and of course, practicing that good physical distancing as we all continue to fight this COVID-19.
All right, thank you again. And I'm sure we'll be talking more about health issues as we go forward. And thank you for joining us, and we'll see you the next time on Crucial Conversations. Our producer today has been Kanisha Roan, who is the president of the Nashville Chapter of the National Association of Black Journalists. Take care, everyone.